Gauteng Emergency Medical Services are gearing up to deal with the anticipated surge in COVID-19 numbers over the festive season. They are today hosting an annual festive season readiness program. But what is the plan as the province gears up to go into the battle with COVID-19? Our reporter, Nqobile Madlala, is bringing us more from Midrand. Nqobile, what's actually happening with the emergency services there? Because usually at this time of year we talk about road safety and they're gearing up for vehicle accidents, car accidents and pedestrians, etc., drownings, and now they've got COVID-19 on top of it.
Yes, Annika, they definitely have a lot on their plates. In fact, we were just having a chat and they were saying that even the fleet that they've gotten this time round has been augmented to ensure that they can, in fact, respond to things like the fourth wave, which everyone has been so scared about at this point. So they want to make sure that they can attend to that. But you all remember, this is the time also where we receive, where there's flooding. So there's also that response in terms of flooding, as well as the fact that the festive season is the time where it's very busy. And since we are in this level at this point, so they are expecting a lot of numbers to also go up, and they are expected to respond to that. But I want to bring in my guest at this point to sort of give us the details. Director of EMS in Gauteng at this point. Could you perhaps give us more details in terms of your readiness for this festive season?
Thank you very much. Yes, today we just basically, like you rightfully said, taking stock and checking if we are really ready for service and to render optimal services for the Gauteng residents. Obviously, as everyone knows, that COVID is currently spreading rapidly, so we had to ensure that we inspect and ensure that we augment additional vehicles that will assist our patients being transported to our health facilities. We are also checking compliance and also readiness in terms of our specialized services, being our rescue services, our advanced life support services that we will be rendering there. Because we know during this time we have high influx of people coming to Gauteng, especially Soweto being one of the areas. And also we're seeing more people still continuing with the parties, which is one of the COVID spreaders as we call it, because we'll be having social gatherings and people don't wear their masks, they don't sanitize, and it creates more workload for us, also putting the system under pressure.
All right. And of course, understanding that there is that increase, are we looking into adding more manpower at this point?
Yes, we are currently have just appointed over 120 EMS officials that will be deployed to all districts in Gauteng. With these vehicles, they will be then equipped with the vehicles that are fully equipped with medical equipment. So they will be deployed to various districts to ensure that they can render the services to all our residents, those that might be affected by COVID or those that might be requiring assistance in terms of any emergencies that we might be coming across with.
And your shifts, will they be longer this festive season?
No, fortunately, our services, by design, we render 24-hour services. So our shifts are in place, where we have shifts that will now be receiving additional manpower during the 12 hours daytime and also during the 12 hours nighttime. So there is no hour that we don't render any service. We're not available to render services to the residents that will be in Gauteng or traveling through Gauteng.
Director, is there areas where you find yourself with more work in terms of hotspots in this December?
Yes, for sure. On Monday, just to give an example, on Monday, we've seen that there's an increase in Pretoria environment where lots of people are around the Rooderplaat Dam. Our rescue teams had to pull out a vehicle out of the river that drove in there, and unfortunately there was also a person that passed on during that incident, that drowned basically in the vehicle. And also we are very concerned about areas like Soweto, where there's normally a high influx of traffic volumes going into the area, and we know that's the area also where we're likely to see more parties, social gatherings and so forth, where people are not wearing their masks, sanitizing, and increasing the risk of the virus spreading in those areas.
And quickly, are we going to be seeing the first responders attending to people mainly at home and not taking them to hospital?
Yes, our criteria of when we respond to any emergency, the call will be registered by our emergency communication center, and part of the questions that they're asking our communities are linked to determine if the patient presents with COVID symptoms. Should they arrive at the incident where it's a query COVID symptom or where it's a very disease, that medical ailment that doesn't require hospitalization, our crews will then, through our communication center, be linked up with the medical officer. That will further advise them as to how to handle, whether to transport the patient to the hospital or to further advise, whereby we'll also be keeping in touch with the patient's families that called us to check if the patient's condition is changing and so forth.
All right. Thank you very much, Director, there. Speaking to us about the impact that they want to play in this festive season, the EMS is telling us that they've added a new fleet, but also they've hired more people, saying that their services will be geared towards making sure that people receive the service under the fourth wave, but also understanding that this is the busy time, and so they will be attending to that. With, of course, the floodings that we spoke about, Nqobile, that they will also have a team that will be attending to all of that. But they're telling us that they remain concerned about areas like Soweto, which is the areas that they will be looking very closely to this festive season.